But I really believe that healing happens when people feel comfortable and feel safe. There's so much that I love about being a therapist. Probably seeing people change. Seeing people walk into my office and maybe they feel hopeless, feeling discouraged, feeling challenged by life stressors, and walking out of Beachway feeling hopeful, having a vision for their life. That's really inspiring to see with people. I think one of Beachway's strengths is truly being equipped to address dually diagnosed patients with mental health and substance abuse issues. I think that part of effective treatment for dually diagnosed clients is first identifying what the root issues are. We've worked a lot with bipolar disorder, and it's responsible for people experiencing drastic mood swings, from feeling in a manic state, which is really elevated, and oftentimes what can come with that is a feeling of euphoria, hyperproductivity. It can feel quite good, actually, being manic. Sometimes with manic states, there can be psychotic features that come with that, where people are not oriented to person, place, and time. That's, oftentimes when, a lot of problematic behaviors can emerge when someone's in that state. And then, of course, the other side of bipolar disorder is, feeling very low lows, very deep depression that is enduring. And people, with bipolar disorder go from, very high to very low. The first thing is to make sure that people are properly medicated, that their medication regimen is sufficient. Medication is, not the cure for everything, but if it's necessary, it's foundational. So making sure that people have the proper medication regimen, and then educating them on, what it means to live with bipolar disorder. Informing them what are the warning signs that maybe they're starting to, work into a manic state or a depressive state. Giving them coping skills that they can use on a daily basis, on a weekly basis, to maintain a healthy state of mind and body. Oftentimes when working with someone that's struggling with depression, it's important to look at, maybe what are some of the environmental factors in their life that are contributing to depression? What are some of the underlying issues that maybe haven't been dealt with that are emerging, in present day, that are causing depression, right? Also, looking at coping skills, or the lack of coping skills that are maybe, perpetuating the depression in people. Just inherently, like coming to Beachway and being in this environment, being around people, having a schedule, having structure, being in a community where people are like-minded, that are sharing their struggles. I think being in that environment, is very helpful, to address depression, and then I think oftentimes, someone's experience in treatment informs what they want to create after treatment, right? Creating a discharge plan for them that includes, being able to have access to a community back at home of people who are working on depression or bipolar disorder. I think anxiety requires treatment when your anxiety starts to interfere with your quality of life, right? Anxiety is a part of the normal human experience. To some extent, we all need it. It informs productivity amongst us. It sometimes gives us a push, when we need that. It's a normal, human experience to have anxiety. But when anxiety starts to prevent someone from showing up to life in the way that they need to or want to show up to life, then it becomes problematic. If they're having panic attacks that don't enable them to show up to school or to show up to work, that's when treatment can be helpful. When anxiety, causes people to be avoidant to the point where they're missing out on things that would bring them joy or would bring them, success in life. I think the different modalities of treatment that we offer at Beachway, cognitive behavioral therapy, DBT therapy, relaxation techniques, mindfulness skills, those are all skills that can be used to help the person's relationship to anxiety. I believe that at the core of therapy, it's developing a relationship. And there's something that a computer screen can't capture, that, you know, being in the room with someone, you know, really gives you a feel about someone's emotions, about someone's thoughts. The goal of Beachway is to get people back to enjoying life to the best of their ability, right? You know, to have the best possible life experience that they can have.